Thank you. Thank you. Thank you for all coming out today. We're going to make it worth your while. Well, I don't really like to waste people's time. So I'm going to fill you full of a lot of information, and whatever I don't get to, leave some time for some questions at the end. And also I give everybody an opportunity if they have some personal questions to answer them privately. We'll give you an opportunity to do that at my office at no extra charge. So you'll have an opportunity to do that too. You heard enough about me. Denise, if you could click off the next to last light there, I think it'll be a little better. Now, click it. That way. Keep going that way. Keep going that way. There you go. Yeah, that's it. Okay. Everybody all right? No sleeping allowed, okay? I'm going to keep you awake. You heard enough about me. This is Dr. Rockenau. She's my associate. I gave you a little bit about her biography also. And she has specialties in anti-aging medicine and also cosmetic rejuvenation procedures and pain, natural pain management also. I'm gonna read to you this mission statement. This is a mission statement that my office and our staff came up with over 25 years ago, and we haven't had to change a word of it. Every word of it was carefully thought about, and I'm going to read it to you and then ask you something about it. Okay, we are a unique multidisciplinary team of professionals dedicated to providing high quality, effective treatment to reduce pain and suffering in a caring atmosphere. Our goal is to educate our patients, their families, and our community, which are all a part of, on how to sustain a lifetime of optimal health and wellness while limiting the need for drugs and surgery. So listening to that, are there any words in there that really are most important to you? Anybody who gives me an answer wins a prize. So you can't lose. There are no wrong answers. Okay, thank you. I'm going to give you a little sample of something I use in the office called BioFreeze. It's a little anti-pain gel, has no side effects. It's very natural also. And so that's a really important statement at the end, limiting the need for drugs and surgery. And you notice I didn't say eliminate. I said limit. If I can cut down on your need for medication, I think I'm doing something successfully. I had a medical doctor who I worked with many years ago. And one day he stopped me in the hallway and he said, Ed, I've been here for a couple of years. I used to practice, and I knew where he practiced before. He was a graduate of Yale Medical School, and he practiced in another practice with about 9 other internists. He was a doctor of internal medicine. And he said, Ed, since I've been in your practice for 2 years, I've seen that I only have to prescribe about 1/10, listen to that, 1/10 of the medication that I was prescribing in that other practice. And I thought about it, we talked a little more, and he said, because I really didn't learn anything about a lot of the things you do here. I didn't learn about nutrition. Spent 4 hours in my 4 years of medical school learning about nutrition. Didn't learn much about exercise, didn't learn anything about stress management, didn't learn anything about acupuncture, chiropractic, or actual natural solutions for pain problems. His tool bag was all medication or surgery. And he found out that there are many ways to fix the same problem or to limit somebody's need for medication. And so I want you to keep that in mind, that no matter what you've been told, that maybe there are some things that your doctor doesn't know about, because this doctor didn't know about it. So maybe there's some things that your doctor wasn't trained to do. And I'm not saying I know everything, but I would say I'm an expert at alternatives to medication and surgery, and he's really an expert at medication and surgery. And ideally, the combination is really what works the best, and we'll talk about that a little bit too. So you filled out this stress survey. I'm going to ask you a couple of questions about that too. You win a prize if you answer any of these too. So how many people checked off at least one thing on the survey? One. Raise your hand. Okay, at least one. Okay. How many people checked off at least two? How many checked off three? Okay. I'm not going to go past three, even though I've had people who've checked off everything, and then they wrote other, and go down the page. And so these symptoms are very common, but they're not normal. Think about that also. They're common. That means lots of people have them, but it's not normal to have these symptoms. They're a problem. They're a sign that something's wrong with your body. And so if you have these symptoms, I'll tell you what that means. If you have more than one symptom, or the one symptom that you have occurs more than once per week, you have a problem you should be concerned about. And that might be part of the reason why you're here today. It's never normal to have a symptom. It's kind of like the light on your dashboard. If it goes off, what's that mean? If the engine light goes off on your dashboard, what does it mean? Something's wrong, right? It's telling you something's wrong. And that's what symptoms are. Complaints about something that your body is saying, hey, something's not right. I don't feel like I think I should. There's something actually bothering me. It's communicating to you that something's not right, needs to be checked. Okay, I'm going to ask you some simple questions. How many people here would rather be wealthy or just not poor? What would you rather be, wealthy or just not poor? How many people wealthy? How many people just not poor? It's okay. There's no wrong answers here. Okay. Would you rather be intelligent or just not stupid? How many people intelligent? Raise your hands. This is an intelligent group then. Okay. Anybody just not stupid? Nobody here wants that one. Okay. The third one is really important. Would you rather be healthy or just not sick? How many people want to be healthy? Raise your hand. Good group. How many people just feel they're okay if they're just not sick? Okay. Really, healthy is a better choice. What is health? What's your definition of health? Health is a state of optimum. That means the best you can be. It doesn't mean everybody's the same, but the best you can be physically, mentally, socially. There are even some more parameters there, but that's what health is. That's a definition of health according to Dorland's Medical Dictionary, which is a dictionary that all medical professionals use. When we want to look up something, definition of something, you look up the health, this is the definition you'll see. It doesn't say just not being sick, did it? No, it didn't say that. It says being your optimum. Would you check your car if the engine light went on? I mentioned it before. Symptoms are a warning that something is wrong. There's no such thing as a normal symptom. You would check your car to make sure it didn't get worse. Your body deserves the same attention. Lots of people take better care of their cars than they do of themselves. My daughter was one of those. She had the engine light go on in her car once. And she said, she didn't decide to pull over right away. She just kept driving. And she finally blew an engine. I said, honey, why didn't you go off the road and go to a gas station or call me or something? But I didn't think it was any big deal. So the engine actually froze and cost us a lot of money. So I would say better to listen to a warning sign and do something about it as soon as possible. Go to somebody who can help you, not just cover up the symptom. A solution to a warning light on a car is not putting a piece of black tape over it. Anybody ever do that? That doesn't work too well for too long. So a lot of the care that we get in this country with medication is almost like putting black tape over a symptom. It's not getting rid of the cause. And this is also a very, very important statement that I'm making. And I want you to think about and I don't know what medication. I saw some lists of medication that people are on. Think about whether they're really getting rid of the cause or just covering something up. What is the definition of insanity? Anybody know this? Anybody? Excuse me? Yeah, well, you can tell me. That sounds right. Yeah, he's insane? No, I'm not. No. Oh, I'm sorry. No, but I didn't mean to joke about that. But insanity is this, doing the same thing over and over again and expecting a different result. It's like, banging your head against the wall and expecting it not to hurt. It's going to hurt. And so you've got to do something different if you want a different result. Think about that also. I'm going to try and make you think about what I'm talking about today, not just kind of spill words out and not have you think about it a little bit. And you win a prize also. Yeah, so here's for answering that. So this is a little stress reduction card. You can take a look at it. It tells you how to breathe when you're a little stressed. And it also has a little measurement of your temperature that indicates if people who are colder in their hands generally are under more stress. It measures your temperature. If I could show you today how to decrease your health problems by doing something natural and affordable, would you do it? Raise your hands if you would. Natural, it's affordable, doesn't hurt. Right. I would say you really have nothing to lose, but I don't want to force you to do anything you don't want to do. Today, you have two choices regarding your health. You can do the same thing that you're currently doing and get the same results, or you can try something new, something different and get a different result. The choice is yours. Okay. I'm going to tell you about something called functional medicine. Has anybody ever heard of that? No? Okay, function means how something works. Medicine is medicine. So this is really science of studying how the body works and how we can make it work better without putting in anything to cover symptoms up, but actually making your body healthier. And when you're healthier, you have less illnesses. Even things like infection can be helped by making yourself healthier. Not everybody catches a cold if there's a bug in the air. The people who have lower resistance are the ones that catch the cold. And so improving your resistance, improving your immune system can even prevent something like that. So getting healthier really helps lots of things, even chronic problems like heart disease and diabetes. And so getting healthier is really, really the goal. We talked about it before. You don't want to just not be sick. Let me ask you another question. Anybody think of anything that could be brewing inside of someone and they don't get any symptoms? They don't even know they have it. What would be an example of that? Any ideas? I'll give you an example of that. So high blood pressure used to be called the silent killer, if anybody remembers that term. So it meant that people didn't know they had it, so they went to a doctor and they got their blood pressure checked. But it was in there. It was causing a problem already, and they didn't have a symptom. I'm saying that maybe you shouldn't just be dictated by your symptoms, but you really should be dictated by a desire to be as healthy as you can be. Can everybody understand that? Yes? Okay. You don't want to wait for a problem. You want to try and prevent the problem. I think that's the ideal thing. There was a statement by Ben Franklin. He said, an ounce of prevention is worth a pound of cure. So everything you prevent is much, much easier to treat and is worth much, much more than just treating it. Prevention. Body systems are all connected. As medicine has become more specialized, we've lost track of this truth. So how many people have been to a specialist lately? Okay. So specialists really, really know a lot about one particular area of the body, one system of the body, but they have lost track of the fact that everything's connected. I'm going to talk about that too. So I had a patient in my office this morning, and really what they complained about was pain. And then I started to ask them about their diet, and everything they were eating, almost everything, was very inflammatory, caused inflammation. And all they were getting for their treatment for pain was anti-inflammatories, a drug that helped calm down the inflammation, but it didn't get rid of the cause. You understand the difference there? Okay. And we're going to talk about why things are connected or how they're connected. Have anybody heard about the gut-brain connection? Yes. Okay. So the gut is our digestive system from our stomach down to our rectum, really. And so what we see now is that there's a tremendous communication between this and this. Even though they're pretty far away, they're talking to each other all the time. There are chemicals produced in our gut that affect our brain, and there are chemicals in our brain that affect our gut. Anybody ever get butterflies in their stomach or a pit in their stomach if they get stressed out? Raise your hand. I mean, I felt it. So that's your brain communicating by a nerve called the vagus nerve to your gut. It's secreting chemicals up here that affect your digestion. And vice versa, there are chemicals produced here that affect your brain. I'll talk about those a little bit more later. Why is there such a connection? Because the nerve cells that created your brain migrated to the gut and while we were fetuses. So some of the cells from up here when we were developing actually migrated to our gut. And it's sometimes called, the gut is called the second nervous system or the second brain. That's how important it is. We don't pay enough attention to it. And instead of just giving medication for the brain only, maybe we need to help the gut in order for the brain to function better. That's what we know more about now. So I'm going to cover 6 drug-free action steps to reduce depression and anxiety and other mental health disorders. These aren't the only ones. It can help something like ADHD, even bipolar disorders, things of that nature also. So there are more mental health problems and just even mood problems. And things like fatigue and brain fog can be helped by some of this, by all of the things that I'm talking about. Some people need all of those action steps. Some people only need some of them. But these are some of the things that I've helped people tremendously with their brain and cognition problems. The definition of depression and anxiety, according to, again, Dorland's Medical Dictionary, depression is a mood disorder that causes a persistent feeling of sadness, loss of interest, major depressive disorder or clinical depression. It affects how you feel, think, behave, and can lead to a variety of emotional and physical problems. So that's the technical definition. Anxiety, feelings of fear, dread, uneasiness that may occur as a reaction to stress. A person with anxiety may sweat, feel restless and tense, and have rapid heartbeat. Extreme anxiety that happens often over time can be a sign of an anxiety disorder. So all that means is we're putting a name on it. We're not saying why. Why does somebody get anxious and other people in the same situation don't get anxious? It's really going to relate to the 6 things I'm going to talk about. To reduce anxiety and depression, drug-free strategy number 1 is optimizing your nutrition and your weight. Your nutrition is such an important part of being healthy. We've studied civilizations around the world. What we found is the ones that live the longest, they have a certain content to their diet, not like we do in this country. They don't have fast food. They don't have things that are really, really processed very much. And so improving your nutrition can improve your health, improve how you feel, and improve how your brain functions, improve how your digestion functions. It really has a tremendous effect on your body. Weight has a tremendous effect on the body too, not just because we're carrying more weight, but every fat cell in your body is a hormone factory. It's producing inflammatory hormones. So the smaller you can make those fat cells by decreasing your weight, the less inflammation you have in your body. I'll talk a little bit more about inflammation because it's really a silent killer. And it's been around and we know about it for at least 20 years. We just haven't done enough about it yet. The father of medicine, Hippocrates, everybody here ever heard of him? So he's the doctor who really started medicine. And what he said was, let thy food be thy medicine and medicine be thy food, and warned us that bad digestion is the root of all evil. So this is connected to this, and it's all connected to everything. And the food you eat has a big, big effect on how you feel, and what your health is going to be like. Okay, healthy eating. And this is just general. Everybody's a little bit different. And when somebody comes into my office, that's what I think about. What's different about this person? Maybe we have to do some testing to figure out what's different about them. But there are some general rules. We evolved from being hunters and gatherers. So what does that mean? The best diet, the one that existed before there was McDonald's, and before there was Stop and Shop, and before there were companies like Nabisco and General Mills, we could only eat what we hunted and what we gathered. Everybody with me? Hunter and gatherer. That existed for hundreds of thousands of years. These other things that I said, like McDonald's and Stop and Shop, They've existed for maybe the last 100 years. So our bodies haven't evolved to handle what's being produced now. We haven't really adapted to it. And quite frankly, we're sicker than ever before, even with all of modern medicine. And so it's partially because of that. Give your body the nutrition it needs on a daily basis to repair and rebuild itself. What's another thing that I found in over 40 years of practice? The body is an amazing mechanism that has the ability to heal itself. It's designed to do that. Think about this. If you cut your arm, you have to think about healing that cut, or does your body do it on its own? Is it the Band-Aid that does it? Is it the antiseptic that does it? Yes or no? No, it's not. Your body has an amazing ability to heal itself if you give it the right raw materials and you don't irritate it too much. I mean, if you get a cut and you start rubbing dirt in it, you're fighting your body's natural healing ability. And the same thing with some of the foods that we put into our system. It's like putting dirt into a wound. Think about that also. The healthiest and most nutritionally dense foods are organic vegetables and fruits. Use grass-fed meats, cage-free poultry, wild-caught fish and seafood, and eat mostly real foods, not too much. Okay, that's a real good rule also. In Japan, they have a rule that they never eat more than 80% full. They don't want to feel stuffed. They always kind of stop at about 80%. What is real food? Name some real foods. What do I mean by real food? Not processed. Good. It's really one ingredient foods. Broccoli is broccoli, chicken is chicken, salmon is salmon. All of those things are one ingredient foods. Nobody's adulterated it. Nobody's added anything to it. Those are the ideal foods to keep as most of your diet. Some people need more help than just that simple statement, but think about that just for starters. Mental health and food. That's why you're here. Harvard and Stanford universities are studying the effects of something called insulin resistance, which is kind of it's tied to diabetes. They're studying the effect of the gut and the bacteria in the gut and how it affects you mentally. Poor metabolism that comes from eating sugar, starch, flour, and how that affects the brain. So they have created departments now to study these things. I'll go into it a little bit more because the medications aren't really solving all the problems. And they found when we combine it with these new facts about how food affects you and how your body is connected to you, the rest of your body is connected to your brain, get much better results. The SMILE trial, that was a name of a study in Australia, studying depression, found that eating real foods work better than drugs for treating depression. Better, but you have to be willing to change something. It's easy to take a pill. It's a little harder to change. A lot of mood disorders like depression, suicidality, violent behavior can be helped with dietary changes. 97% decrease in violence in juvenile detention centers occurred, and a 75% reduction in restraints and suicide when the detainees were fed real healthy food. They didn't have to get, put into straitjackets or handcuffs. They were fed healthy food. All of a sudden, less suicides, less violence. That's how it affects your brain. Fix your whole body, especially your gut and your food choices, and then you fix your brain. Our nutritional needs have changed drastically in the last century due to the amount of stress we're under, the amount of pollution in our environment, the fact that our soil has become depleted, causing our foods to lack the same amount of nutrients they once contained. Brain inflammation has been causally related to depression and anxiety through imaging and research. We know that the brain gets inflamed. We can see it on a picture. And the thing is, get rid of the cause of the inflammation. Don't just give somebody an anti-inflammatory and keep eating the same junk that's causing inflammation. It's like trying to stop a flood by putting up a dam, and you really have to really stop the flood. That's the ideal. Okay, this is an article that was written over 20 years ago in Time magazine. It's called The Silent Killer. And maybe it's a little hard to read, but it's about the surprising link between inflammation, heart attacks, cancer, Alzheimer's, and diseases of other diseases, and what you can do about it over 20 years ago. And they just gave us a couple of lists: foods that cause inflammation, foods that fight inflammation. So you can look more into it. It's something I'm an expert in. I would be glad to talk to you about it more. Avoiding inflammatory foods offer dramatic changes in how good you feel or function, especially in these 4 areas. So bad foods affect 4 areas mainly. They affect your energy, they affect pain, they affect how you think, and they also affect your digestion. So that's a mistake. Function isn't what should be there. They affect your digestion. 4 areas. If you have problems in any of those 4 areas, food could be the cause of it. These are the 3 worst foods, in my opinion, that people eat all the time. Anybody ever been to the shoe store called DSW? Anybody? Okay. So think about DSW the next time you go to the shoe store and what I think it should stand for: dairy, sugar, and wheat. The 3 most disease-causing and inflammatory food groups in our diet and strongly affect mental health. 60% of people are dairy sensitive. Doesn't mean they have an allergy to dairy. Doesn't mean they're lactose intolerant. They're sensitive to dairy. And dairy is not essential after weaning. What we know is that there's no animal in the world that drinks milk except human beings after they're weaned off their mother. Everybody with me? So it's not absolutely essential. It's a marketing trick that the dairy industry has pulled on us for many, many years. As a matter of fact, the countries that have the highest consumption of dairy have the highest incidence of osteoporosis. People think dairy is a wonderful source of bone density nutrients. No, but we don't need it. We need to eat other things besides dairy, much more. Average per capita consumption of sugar is 150 pounds per year. Think about that. That's the average person consumes 150 pounds per year of sugar and things that turn into sugar. Now, that's now, and it was a half a pound a year in the year 1900. We've 300 times as much sugar in our diets as we did in the year 1900. Do you think that could have an effect? I mean, just what do you think? You put 300 pounds of something into your body that was only a half a pound a little over 100 years ago. Think about all the disease that could possibly cause, that is being caused now just by that. Average per capita consumption of wheat flour products is 135 pounds a year. And overall, wheat turns into sugar also very, very quickly. 60 to 70% of people have a wheat or gluten sensitivity. Very much connected to mental health problems, very much connected to diabetes, and lots of inflammatory problems. There's a book written called Grain Brain, talks about just the connection between wheat and your brain. Average American diet is fiber deficient, nutrient deficient, leading to a grossly overweight population. It's living a shorter lifespan for the first time in 20 years this year. So here's a little picture and a little statement. Food can be your best friend. So here it's an example of it being, being your best friend. At the top, people eating fruits, vegetables, healthy foods that look pretty happy and healthy looking. And then we've got somebody who had a pizza and a beer. And it's not far off. It really, these foods are the things that cause how you feel cannot be ideal and how your health is not ideal. So food can be used as medicine. It's a very powerful medicine. That's what I found in 40 years of practice. I've turned around so many problems that people were told there's nothing that can be done. We've done our best. We've given you the best medication. We've given you the best surgery possible. And changing their food still improves their health. What gets lost in discussion about mental health is a simple truth. The food you eat can have just as profound an effect as the drugs you take. And I don't suggest to anybody they go off any drug that they were prescribed, ever. So that's something between you and the doctor who prescribed it. But this is in addition to it. So this makes the drugs work better. It makes you need less of them. You can feel better than you do without the side effects of the drug and the possible addiction to that too. According to the Encyclopedia of Natural Medicine, a deficiency of any single nutrient can alter brain function and lead to depression. So if you're missing vitamins and minerals in your diet because we're so depleted now, our soils are depleted, our processed foods are depleted, it can lead to depression, anxiety, and other mental health disorders. There's some common deficiencies: B6, B12, folic acid, magnesium, tryptophan. I don't want you to go out and buy these nutrients, okay? Lots of people who just want to write them down. I'll get them. That's going to be the secret. Supplements are in addition to a good diet. They're not a substitute for a good diet. So you can't have Fruit Loops every day and take a vitamin and be okay. All right? It just doesn't work. The health factors that can lead to depression and other mental disorders, such as ADHD. Everybody know what that is? Okay, attention deficit hyperactivity disorder, anxiety, bipolar disorder, include hormone imbalances. That's one reason why people have these things. Vitamin and other nutritional deficiencies, low blood sugar, food allergies, toxicity, the poisons that are in our environment and in our foods, drug reactions, and unresolved pain. All of those things are some of the things I'm going to talk about still, are really, really affecting our mental health. On the subject of depression or anxiety, one must also consider the possibility of low blood sugar. That's really important. There was a book written a long time ago, about 1975, called Sugar Blues. Anybody ever heard of it? Okay. And what it said was, sugar gets you depressed, makes you moody, makes you tired, because your body reacts to the sugar. It goes up, and then it comes way down. And in that down period, you're down. When the blood sugar goes down, your mood changes, your energy changes. And this is something that was written almost 50 years ago. Okay. There's a new book called This Is Your Brain on Food. And this was written by, Dr. Naidoo is the author of the book, Your Brain on Food. She's a psychiatrist, a nutritionist, and a chef, all rolled into one. And what she found out after she went to medical school, became a psychiatrist, said, I'm still not getting the results I want with the patients that I have just by putting on medication. She went to train as a nutritionist. And then she also went to train as a chef, so she teach people how to cook with healthy foods. And what she found was the goal of nutritional psychiatry. It's a new division of psychiatry, and it's really being established in Harvard and Stanford, two of the best schools in the world. The goal of nutritional psychiatry is to offer the patient the information they need to make healthy food choices for better mental health and limit one's need for medication in many cases. That's my statement. And I made that statement 25 years ago. There's a way to limit your need for medication. You have to do something different. Keep doing the same thing over and over and expect a different result. What are you? I told you before. Insane. It doesn't work. What should I eat? Okay, what should I eat? There's so much information out there. There's this fad and that diet. And there's, should I be on a keto diet, a vegan diet, a paleo diet, a Mediterranean diet, a vegetarian diet, a vegan diet, a plant-based diet, a whole food diet? Well, everybody's a little bit different. And some of the factors in all of those are good for you. Some of them not necessarily. You need an expert telling you which ones would be ideal for you. You can't go by what you're hearing on television, what somebody else told you. It's just not going to work perhaps for you. You need to know what you need and what is going to help you the most. So eat more real food. That's pretty true for almost everybody. So no one size fits all. Sometimes you have to test for things too. I'll talk to you about that. Healthy eating should be designed to reduce, remove, or prevent the causes of your health. It should make you feel better. If it's not making you feel better or preventing some of your illnesses or improving something, it's not the right food choices. Everyone's different, and diet needs to be personalized. Study shows adherence to the Mediterranean diet, which is really still being voted the best overall diet, 11% decrease in cognitive impairment. You think better on this diet. It brings 51% increase in the quality of your life, 10% higher odds of successful aging, and all having the potential of mental cognitive health benefits. Just by doing this. Do you think there's a medication can do all of that? There isn't one. There isn't one. Doesn't exist. Utilize these secrets of permanent weight loss. I told you a little bit about weight. I'm not going to go into too much detail about that, but I've seen hundreds of patients for weight loss problems. When they lose weight the way I tell them, by healthy eating, everything gets better. Their energy gets better. Lots of their health problems get better. It's the side effect of good food and good eating. That's the side effect. There's no negative side effect. To reduce anxiety and depression, drug-free strategy number 2, balancing hormones and brain chemistry. Two primary glands involved that can precipitate depression, involve the thyroid and the adrenal gland. Anybody been told they have a thyroid problem? Anybody? Okay. Many times thyroid problems go undetected. Blood tests are not the ideal test. They don't detect everybody. But one of the signs of thyroid problem is lower temperature on a regular basis. So sometimes I have to do a little screening test. They take the temperature 3 days in a row underneath their armpit before they get out of bed. The temperature should be at least 97.6. If not, I suspect the thyroid problem. Keep going. Screening test for hypothyroidism, we talked about that. The second gland is the adrenal gland. Everybody ever heard of that gland? Adrenaline? You guys hear of that? Yes? Okay, let me know you're still awake. I can't tell. All right. So adrenal gland, it has to do with adrenaline. That gland produces adrenaline, and it's the stress-fighting gland. We get stressed, our body produces adrenaline, produces other hormones, changes our heart rate, changes our blood pressure, changes our energy level, changes how our pupils react to light, does a lot of things because it's the fight or flight mechanism. You know that? Have you heard of that? Okay. So how many people are getting chased by saber-toothed tigers nowadays? Anybody? No? Okay. So that's what that mechanism evolved from. When we were in a cave and the only thing we could do is run out of the cave, eat something, run back in the cave, you needed to be fast and strong quickly. Fight or flight. We don't need that anymore. We don't have saber-toothed tigers. Now what we have is chronic stress. It's there all the time. You turn on the TV, stress. You put on your computer, stress. Your kids call you, stress sometimes. I mean, so I can't get rid of your stress, but this is what I've been successful at, is reducing the harmful effects of stress. Everybody can do that by doing some healthy habits. You can do that. Your stress doesn't have to bother you as much. It doesn't impair your health as much. This is a little complicated. I'm not going to go into that. Anybody ever been on what's called an SSRI medication? You don't have to say anything, but SSRIs are the three most common ones are Prozac, Lexapro, and Celexa. Those are the three most common ones. How do they work? Okay, they work by increasing the amount of serotonin that your brain gets. I gave you a little handout about the happiness chemicals. You can look at it another time, but it teaches you what you can do to increase serotonin. When you have more serotonin in your brain, you feel better, your mood is better, you're less depressed, you have more motivation and energy. And where is the serotonin produced? 90% of it here, not in your brain, starts here. So if this is bad, what do you think this is going to do? What do you think? Is it going to be working at its optimum? No. If your digestion's a problem, then your brain's going to have a problem. So sometimes we have to really, many times we have to fix this in order to make this better. Not so difficult, but just looking at your brain and giving you a medication so that you don't, what SSRIs do is they suppress the absorption of the serotonin. So in other words, instead of it getting into the cells and staying there, it stops it from doing that. So you have more serotonin in your brain to make the brain feel better. Everybody understand that? It's a little complicated, but it just means it's coming from here. If this is messed up, you're not getting enough serotonin. And what medications do is they stop your cells from absorbing the serotonin, so more of it is floating around your bloodstream and your brain can use it. But food alone and what we can do to heal your gut can help it tremendously. So this is the handout I talked to you about. And so also exercise, sunlight, massage helps increase serotonin. This increases happiness levels. Deficiencies can be low self-esteem, overly sensitive, anxiety, panic attacks, mood swings, feeling hopeless, social phobia, obsession, compulsion, and insomnia. So all of those things are signs of depression and maybe a serotonin deficiency. To reduce anxiety and depression, another drug-free approach is stress reduction. Anybody here who doesn't have any stress? Anybody? Nobody. I would say you'd be lying if you said that you had no stress. First of all, I'll explain that stress isn't just mental. It comes from other places too. So what is stress? Any type of change that causes physical or emotional strain. It can be short-term or long-term. I told you about that. Short-term is running out of a cave, getting some food, running back in so you don't get eaten. That's short-term stress. Long-term stress is what we are going through nowadays. It's different. Our bodies have to be different because we have different types of stress now. And just giving somebody an antidepressant or an anti-anxiety drug doesn't get rid of the stress or reduce its harmful effect. It covers them up, like putting black tape over the engine light in your car. Today, stress is much more commonly long-term than ever before. This is what I was going to say. There are three major categories of stress. It isn't just mental. What could be chemical stress that I've been talking about for a little while already? What things in your lives could be a chemical stressor? Come on. I gave you enough to say something. What do you think? Still win a prize. What could be chemically stressful? Sugar. You win a prize. Did I give you a prize already? Okay. So sugar is a drug. It should be treated like a recreational drug. Doesn't kill you right away, but it can kill you very, very, very long-term, very much so, especially at the quantities that we're eating. So that's a stress to your body. It's like this. One doctor who was a teacher of mine said to me, if you walked out into a forest and there were Snicker bars on the trees and you ate one of them instead of a fruit, let's say there were Snicker bars on all the trees. Every time you had a Snicker bar, your body would think, what the heck did he put into my, what the heck did I put into my gut, stomach? And you have this alarm that goes off because it's an emergency. Blood sugar goes way up. Your body has to do all sorts of things to bring it down, brings it down too far. You feel good for a little while, feel crappy for a long time. So Snicker bars don't grow on trees, and thank God they don't. But the things that grow on trees and our plants, they're very, very healthy. So they're not meant to be growing on trees. They're not meant to be eaten very often. Increased physical, mental, or chemical stress causes increased cortisol levels that lead to hormonal imbalance and the harmful effects of stress. So we do a screening test, and you'll all have an opportunity to experience this. And when somebody comes into my office, I do two things. I measure their blood pressure in two positions, which usually is not done in the traditional medical doctor's office. Why? Because the stress of standing up quickly, that's a stress. Your body says, oh, I better raise the blood pressure because I got to raise blood all the way up to this higher level. Think about it. Go from sitting to standing. That's a stressful emergency. Your body has to raise your blood pressure. 75% of the people that I see, their blood pressure drops down. And you may be experiencing it already if you're overloaded with stress or your stress fighting system isn't working too well. You get lightheaded if you stand up. That's one little sign of it. Not the only sign, but it's one sign of it, and we test for everybody for that. Because many people come in here and say, well, I've got digestive problems. Well, I don't know if it's just coming from here, but it's coming from the overload of stress in your body, causing these chemicals in your stomach not to be produced the way they should. Mental stress can affect the brain and your gut and your brain. So in other words, it's really a two-way street. I'll talk about that too. 2 hours of psychological stress. Tense family Christmas dinner, bad traffic can upset the balance and what you feel in your gut. You're in the car, there's traffic. You don't just feel it up here. Lots of times you feel it down here because it's changing the bacteria and how they're responding to the stress that you're under. It changes it, and you have to do something to balance it out. Creating the right balance. So this is my little drawing of how to create balance. So if we were to look at a teeter-totter, you know what a teeter-totter is. So if the bad stressors, like bad foods and emergencies at home and news on the TV are even with the good stress, good things that you do, eating well, exercising, sleeping well, then you've got average health, at least average. If the bad stresses are weighing more than the good stresses, guess what? You got poor health. You got many symptoms. And if the bad stresses weigh less than the good, and the good ones weigh more than the bad ones, you got better health. So one thing I also tell people, and this is my statement, increased stress requires increased healthy habits to reduce the harmful effects of stress. So when we're under stress, something happens, we get sick, we're in a hospital, a family member gets sick, we get stressed from that. You have to do more healthy things in order to balance it out. And what do most people do when they're under stress? Eat more, not the good stuff either. Usually the bad stuff. They eat more, they drink more, they smoke more, they sleep less, they worry more. All of those things ruin the balance. Whereas if you want to get out of feeling crappy after a stressful event or during a stressful event, do more healthy things. Get better sleep, eat better, exercise more, think good thoughts, go outside for a while. All of those things help tremendously. Okay. There's a pamphlet. Some of you didn't receive this, but it talks about the test for adrenal gland function and fatigue. But these are the common symptoms. Think about this. This causes all of these at times. Sleep problems, headaches, fatigue, weight gain, mood swings, allergies, sinus problems, digestive problems, and pain. So instead of giving somebody a medication for this and a medication for that and a medication for this, and or the coffee for this, or just telling you not to eat for this, all of these things are helped when we help the adrenal glands function better. It can be done with diet, it can be done with some supplements, it can be done with some stress reduction without any medication. And it fixes all of these. Some stress reduction techniques, breathing. Breathing is one of the most important things. I gave you a handout in your handout. It's called diaphragmatic breathing. You can take a look at it. I'm gonna teach you that today. Okay, I want you to go away with something. So I want you to put your hands on your belly. I want you to go away with a lot of things, but you might as well go away with this also. So if you breathe in through your nose, just try it. You hold your hands on your belly. Watch me. I'm going to breathe in through my nose and watch what my belly does when I breathe really deep. What got bigger? My belly. Okay. Well, who breathes like that? Musician. Good one. Who else? What age group breathes like that? Infants. You watch an infant breathe, their belly goes in and out. We stop doing that. We breathe like this, or at least most people. But if you breathe all the way down to your belly, you're exercising a nerve that goes from your brain to your diaphragm and produces serotonin, which makes you feel better and relaxed. So that is a really, really important exercise. Qigong. It's an ancient Chinese martial art that I gave to lots of people during COVID to help their immune system and decrease stress. You can look at it. I gave you a resource sheet that has how you can find that exercise. This sheet also, okay? You'll feel better. You'll feel more relaxed and more energized if you do it. No medication needed. Getting out of pain naturally, that's another tremendous thing. Physical stress and pain can lead to 89% of adult Americans have some sort of pain on a monthly basis. It's pretty common. These are some of the things that we do in our office that are all non-medication techniques and methods to help people with pain. An anti-inflammatory diet, something called Graston technique. I think I gave you something on that too. Yes. So it's a pain-reducing technique. It's like deep massage. Massage is tremendous for relieving pain. I'm an acupuncturist also. I use electrical acupuncture and also needle acupuncture. Tremendous for helping relieve pain. Exercise, all these things are really, really helpful. Hey, what can you tell about somebody who's depressed also? What's their posture look like? What do you think? Are they walking around like this? Yeah, all right, everything's cool, everything's great. Or are they walking around more like this? Yeah. You can almost tell when somebody's depressed by their posture. And if you do it long enough, it starts to get ingrained. Your body actually holds on to that. And I look at everybody's posture that comes to my office. We do a measurement. We actually do a scan of your posture from your feet up. And if you are really, really having stress physically and you're in pain, your posture probably is playing some part. Nobody really, I can't say nobody, but very few doctors ever look at that in the way I do. Poor posture can be an indication of poor mental health, contribute to extra physical stress such as fatigue and pain to the body. To ideally help with pain problems, mental health, and energy, ideally reduce and eliminate pain through drug-free physical treatment. This is a little bit about the electrical acupuncture that I do. You don't need to know too much about it, but think about this. Is pain caused by a deficiency of Advil? In other words, because you don't have enough Advil in your bloodstream. Is that why you got pain? No, it's not getting rid of the cause. Get rid of the cause. Get rid of the cause. Don't cover it up. And you know what else? Advil, if you take 1,000 of them in your lifetime, you've got 8 times the chance of getting kidney failure before you die. 8 times the chance, 1,000 in your lifetime. And at Costco, they sell them in 750 tablet bottles. People are buying them like that. So don't take over-the-counter medications lightly either. They have major problems. Okay, this is about Graston technique. The right types and benefits of exercise. Is there anybody here who exercises regularly? Just, at least 3 times a week does something. Okay. It's really important. You can't feel as good as possible if you don't do some of those. I'm not saying you have to become a marathon runner. You have to do something. You have to set aside 20 minutes, 3 or 4 times a week, at least, to do some walking, if nothing else. Because you can reduce the harmful effects of emotional stress by walking. A California study found that a 10-minute walk is enough to increase your energy, alter your mood, affect a positive outlook for 2 hours. Just a walk. You don't need to take something to do that. You just need to take a walk. That's it. The body has ways of making pain bearable. On that sheet that had happiness chemicals, one of them was endorphins. Endorphins are your own body's painkillers. You'll need less painkillers if you do some exercise. Exercise will keep your body functioning better. Okay, a Duke University study pointed out remarkable connection between depression and one's physical condition. A group of 156 elderly patients diagnosed with major depression were divided into 3 groups, including one whose treatment was only a 30-minute walk or jog 3 times a week. That was their treatment. That was it. You know what happened? After 16 weeks, 60% of those who walked regularly no longer met the criteria for depression. Nothing else. They didn't have to change anything else. Just that. Imagine if you did more than that. You ate a little better, you slept a little better also. How good you could feel. Getting proper rest and sleep, speaking of sleep. Is there anybody here who wants to age faster? Raise your hand. Anybody wants to get older faster? Like we're just sitting here and you're getting older. Everybody's getting a little older, but if you want to get older faster, this is one way to do it. If you want to age faster, ignore your lack of adequate sleep or the poor quality of your sleep. If you ignore it or cover it up with NyQuil, Tylenol, PM, or Ambien or Lunesta, you are going to cause your body to age faster, plus have the side effects of the drug. Plus that. Proper sleep equals 7 to 8 hours nightly of rejuvenating sleep. Sleep disorders impact mood, heart disease, diabetes, and autoimmune problems. So these are the factors that worsen your sleep problems: stress, hormone problems, dietary factors, certain medications, poor sleep environment. How many people sleep on their backs? I'll give you a little tip here. Good. How many people sleep on their sides? How many people sleep on their stomachs? How many people don't sleep? Everybody sleeps at least some. So the 2 best positions are back or side, and you have to have a pillow adjusted properly. That's one of the things I talk to patients about if their posture isn't good or if they wake up uncomfortable. Screening testing that we do. So there's too many here to go over, but I would say some of the unique ones that I do are something called the adrenal stress index test and also food inflammation testing. So this is something that is either a saliva test or a blood test. Personal treatment for a complete, comprehensive, and personal program. Each person must be individually evaluated to determine the cause. The cause. What did I say? The cause of their depression and anxiety problems. Okay, I told you about the blood pressure test. Another one is how your pupils react to light. Anybody here is very sensitive to lights? Like you have to wear sunglasses every sunny day, even always. You have a hard time at night driving, sometimes the lights come at you. And so that's because your adrenal glands are tired and they can't make your pupils small enough to restrict the amount of light going into your body. I do a little test on that first time somebody comes in. This is called the ASI test. It stands for Adrenal Stress Index Test. It's an at-home saliva test, which is exactly what you want. Measures specific chemical messengers throughout an entire day. It's superior to blood tests, which are the only ones that are used mostly in traditional medicine for assessing daily hormonal balance and rhythm. We're supposed to be awake during the day and asleep at night, not the opposite. Sleep at day and awake at night, not the opposite. So rhythm. And if you're under stress, what happens is you're secreting this chemical called cortisol, which controls your sleepfulness and your wakefulness, and it spills over into the nighttime, and you can't sleep well. So you have to find out if that's the problem. Why didn't my doctor tell me about this? Give you an idea? The answer is it isn't part of their training. Still not. Still not. Very rare. Still not. Why? Well, because most are trained to prescribe medication, and this approach to help people requires more than just giving you a pill. It's talking to you, analyzing why you have a problem instead of just writing a prescription. In order to get a different result, you have to do something different. This is a test I told you about, the food inflammation and gut barrier test, tremendously connected to mental health problems, and also just how you feel. Anxiety and depression is the #1 symptom that we look for related to this test. Bloating, stomach pain, difficulty losing weight, impotence, libido, fatigue, insomnia, joint pain, constipation, diarrhea, craving sugar. All of these things can be delineated when we do this test. We can find out about whether food is part of it and whether your gut is letting poisons into your system. We also look for some of these things. I'm not going to go into detail here. This is really important. So here's your brain. Sorry, the brain is on top, obviously. This is your gut. And the brain communicates with your gut, and your gut communicates with your brain. It's like a two-way street. What happens in the gut does not stay in the gut. The gut and the brain are connected by two-way streets. Always. There's an expression, you know, what you do in Vegas stays in Vegas. Did you ever hear about that? Okay. So what happens in your gut doesn't stay only in your gut. It goes to your brain. Depression, anxiety, PTSD, ADHD, insomnia, decreased libido, bipolar disorder, and even schizophrenia are all associated with altered gut bacteria that get changed by what you eat, but what you think also. One of the primary reasons many approaches fail is simply because they're incomplete. Haven't looked at everything. Even though the doctor said we've done everything we can. There's nothing else I can do. We didn't do perhaps what I talked about during this whole lecture. It's like the piece of a puzzle is missing still. Something is missing. And just like a splinter, if you don't take the whole splinter out, it still causes problems. Problems associated with medications, there are many. They usually have many unwanted side effects. They never actually handle the reasons for anxiety and depression. Here's one of my favorite pictures, the pill head. Okay. So the pill head tells us that the pharmaceutical industry doesn't create cures. How many illnesses have really been cured? What they're really doing and what they're designed to, what they're motivated to do is control your problem, not cure it. Why? Why do you think? If they cure it, what happens? They don't make any money in it. Cures don't make the money. Designing drugs that control your problem, putting you on blood pressure medication for life, putting you on mood-altering drugs for life, putting you on digestive problems for medications for life. Control your problem. Whereas what I'm talking about cures problems. Cures problems, gets rid of them, and prevents future problems. Prescription or even over-the-counter medications control and cover up symptoms, don't fix the cause. Well, you can see this. According to the British Medical Journal, depression can be caused by an adverse reaction by drugs also. So these things cause problems. If you're on any of these, it could be part of why you don't feel as good. Ibuprofen, Xanax, Lipitor, Libin. Some of them are some of the most common drugs used nowadays. As we age, even though our population is taking more medicines, I had somebody in my audience who was a pharmacist a couple of weeks ago. She listened to what I talked about. Said the same things I'm talking to you about. I wasn't too friendly about the pharmaceutical industry. At the end of the talk, she said to me, I'm a pharmacist. said, you know how many medications I take? 0. That was her answer to me. She said, I really, really have a cautious and really, really cautious attitude toward medication because I know what they do and what they really can cause. But she tries to stay as healthy as possible without medication. She was a pharmacist for 22 years. I take 0 medication. On the average, pharmacists take 1 to 2 medications. You know what the normal average person takes when they're 60? 4 to 6, at least. I'm going to go through these. So why aren't we healthier? As we age, even though we take more medications, our chronic disease have become more prevalent. Our lifespans have decreased. The quality of life hasn't improved. Ideally, remove the root causes of many diseases. I'm going to go further. I'm going to read you one testimonial of a patient that I had, just what she said about the care that I gave her. I began as a 65-year-old female patient of Dr. Markowitz at Advanced Wellness and Injury Center. My symptoms initially were fatigue, hot flashes, night sweats, difficulty staying asleep, mood swings, vaginal dryness, repeated urinary tract infections, and pain. My symptoms improved tremendously in an 8-week period with Dr. Markowitz. And the center's comprehensive approach included a hormonally balancing diet, supplement for my adrenal glands, a supplement to enhance my immunity, a bioidentical cream based on blood testing and stress-reducing activities such as yoga, exercise, and meditation. Included in my care was health-enhancing treatments of massage, electrical acupuncture, manual therapy. He's somebody who listened. And it had a tremendous effect on her life. She was taking a tremendous number of medications, not on any of them. Any. I'm not saying everybody has those results, but that's the potential. So my goal is not to convince you of anything. It's that I hope I educated you a little bit. I can't give you all the information I'd like, and it's not personalized. So my goal is to really educate you, so it'll cause you to think and ideally do something different, do something maybe different, or at least find out about something. You don't have to do anything. Just think about it some more and have an opportunity to do something about it. So I give everybody that comes to any of my presentations the opportunity to do something different, or to at least have the opportunity to do something different. So I'm a member of, Denise mentioned it, Foundation of Wellness Professionals, and I have 2 obligations. One is to provide 30 educational talks like this a year. I have to do talks like this in order to stay a member of the organization, because we want to make a change in the world and the health of our country and our community. Obligation 2 is to invite everybody who comes to one of these talks for an educational visit. There's no obligation, there's no cost, and we do the testing that I'm going to tell you just to see if we can help you. And to our wellness center to determine if natural solutions can be used. Just maybe help you with some of the things you checked off on that sheet. Education alone is powerful, but not as powerful as education with action, which can be life-changing. So if you do something about it, if you just sat here and everything that I said went in your right ear and out your left ear, it didn't stop in the middle, I didn't do very much for you, but I can do a lot more if you give me a chance. So, what we give you is a complimentary consultation with me, a screening test for stress and adrenal fatigue, computerized postural evaluation, a diet diary review, and a pain evaluation. You're gonna get, if you want to take advantage of this, you could talk to Denise. She'll give you an envelope. That envelope will have all of these things in it. And the envelope on the outside will have times that you could choose that schedule a time. You can do it right here. Doesn't take any time. Pick a time that's good for you. We set aside enough time so everybody here could have an appointment in the next few weeks. So I put it, and I take it very seriously. I set aside time. If you make an appointment, please don't just not show up. Then I have to send Denise after you. No, I'm just kidding. But that's not fine. You know, so I would say I make the time because I take it seriously. I will give you my best if you come and talk to me. And I think you'll find out something that you didn't know before, even more than I talked about today. This will be about you personally. This is a health pass. I'm going to give every one of you that wants one, at least one of these, that you can, let's say you have a relative or a friend that you know is having health problems and you don't know what to do about it. Well, they've tried so many things. I'd be glad to offer them the same opportunity to come into our office. You can take one for them and I'll sign it so that, you know, they know that they can come in over the next month, anytime next month. They can set a time and it'll be free also for the same visit. So this is my last slide. There's hope. There's hope. I hope I didn't depress anybody here. You know, you came in maybe with depression. I don't want to depress you. I want you to think about hopefulness and that there's things you can do. You do something different. So you can improve your mental health. You can live longer and healthier. You can have less pain, have more energy, sleep better, limit your need for medication and surgery. Anybody know who Michael Jordan was? Wiz, still around, right? Everybody? So he was considered the world's greatest basketball player. But what most people don't know is that, and he won 6 championships. He didn't win any championships until he had a world-class coach. His name was Phil Jackson. Helped him win 6 championships. Why? Because even though he had all this talent, he needed somebody to get the most out of him. That's what I'm like. I'm like the coach that you need in order to get the most out of your body and give you the best health possible. You can't do it on your own, I don't think. And you won't get the same results. To try, take a vitamin here, do something a little different. But if you really want to get results, you need a good coach. You need a great coach. So I consider myself a great coach. I've been doing it for 44 years. I've treated 20,000 patients very successfully. I can't say everybody has had a perfect situation, but almost everybody has been better by the care that I've given them. So if you want to take advantage of our opportunity, talk to Denise before you leave. And if you want me to stick around a little bit, I'll answer any questions privately. I don't want to have questions out in the open or somebody might be feeling personal about. And I think we have a Zoom meeting still going on, Helen. Okay, so I want to say hello to the people in the Zoom class. We're going to leave some information for everybody also. And please contact our office. We'll have an opportunity to do that, to have one of these free visits. It won't cost anything. It doesn't hurt to find out. And we'll let you know whether we can help you or if we can't help you. I'll let you know that too and send you to the best doctor possible. Thank you for being here and appreciate you taking the time. Thanks a lot. I look forward to seeing you.